Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, I'm Aditi Gangar from Thip Media. How many of us actually know that cancer is a silent killer? A report by WHO informs that every one Indian out of 10 develops cancer in their lifetime. Also, a data released by National Cancer Registry Program informs that tobacco alone contributes to 35 to 50% of cancer cases in men and 17% cases in women. Both the data highlights the fact that the burden of cancer disease is huge on Indian population. Whenever we talk about cancer, we often believe that it is an untreatable condition. However, it is not the reality. Medical science has improved enough to invent treatments which are much safer than chemotherapy and can kill cancer cells at an early stage to improve the chance of survival. One such treatment is radiation therapy. Today, we have invited Dr. Sarthak Moharir to discuss the basics of radiation therapy. He is a radiation oncologist working at HCG Cancer Centre, Vadodara, Gujarat. Welcome, Dr. Moharir, to Thip Media's show Health Files. My first question is, how does radiation therapy work against cancer?
So radiation therapy is nothing but X-rays, the same X-rays that are used to take a CT scan or a chest X-ray in a hospital. We just increase the energy of these X-rays to 1,000 times, and we use this to treat the cancer. This X-ray basically damages the DNA, and that is how the cancer cells are killed.
My next question is, when does a cancer patient need radiation therapy?
Aditi, 90% of the patients who come into my hospital will need radiation therapy one or the other time. Radiation therapy mostly and largely deals with the solid tumors. That means tumors excluding the tumors of the blood. Depending upon what time the radiation is being given, there can be many indications. For example, some patients might require neoadjuvant radiation, which basically means the radiation is to be given before a surgery so that the tumor is downstage and the surgeon can take the tumor out easily. Or it can be in a radical setting, for example, in cancers of the uterine cervix, or cancer of the vocal cord, or cancer of the prostate, where the radiation is the only modality of treatment that you need to cure the cancer. Or it can be in an adjuvant setting, which means that the surgeon has operated the tumor. The histopathology report tells us that the tumor is a little higher stage. So the patient needs adjuvant radiation to bring down the risk of recurrence of the disease. In stage 4 cancer patients, patients who have symptomatic painful metastasis in, for example, the bones, or metastasis to the brain, the radiation will play a palliative role. That means we give radiation to ease the pain and suffering of the patient.
What type of cancers are treated with radiation therapy?
So we treat a large variety of tumors. In my practice, currently, the bulk of my treatment patients include breast and head and neck, which is the large burden of, which makes a large burden of cancer patients in India. Apart from that, we also treat a lot of prostates. We treat cancers of the uterine cervix. We treat cancer of the endometrium that have been operated and then require radiation. We also treat a lot of laryngeal cancers and cancers of the vocal cord and cancers of the brain. We also do something called stereotactic radiosurgery, which basically means when the surgeon cannot reach the tumor with the knife, we use radiation as a form of a digital or an X-ray knife to take this tumor out.
What are the side effects of radiation therapy?
Okay, so the side effects vary according to where the radiation is being given. One of the biggest myths associated with radiation is that radiation will burn off your skin, it will make you lose your hair, and things like that. So basically, the radiation of today, of 2022-23, is highly focused radiation. That means the radiation affects only and only the area where the radiation is being targeted, and it spares the surrounding organs at risk and also spares the rest of the body. So depending upon the site where the radiation is being given, the side effects can vary. For example, if the radiation is being given to the head and neck region, there will be blackening of the skin. There will be some ulcers or mucositis in the mouth and the neck, in the throat. Apart from that, the patient can experience dryness of the mouth, intolerance to spices, and sticky, slimy saliva. Uh, Similarly, if the radiation is being given to the pelvic area, for example, for radiation for cancer of the uterine cervix or the prostate, the patient can experience, again, the blackening of the skin is common to all of these treatments. Apart from that, if the pelvic radiation is being given, the patient might experience some burning in the urine, or some burning sensation while the patient defecates or poops. So these are the common side effects. Apart from that, a very small percentage of patients might experience diarrhea with pelvic radiation. Similarly, if the patient is being treated for cancer of the breast, uh, breast treatment is very straightforward. It is very simple. There's just blackening of the skin. The patient might experience some difficulty in swallowing. All these side effects that I've mentioned till now, they don't last forever. The blackening of the skin, the burning of the urine and burning during the defecation, and the ulcers in the mouth and the neck, these take approximately 3 to 4 weeks to completely go away. The side effects that I mentioned, for example, the sticky and slimy mucus, and the inability to taste food, or intolerance to spices, these side effects take about, they improve at a rate of about 15 to 30% in a year. So these are the side effects that take a little longer time to go, but they do eventually go away.
What is the special diet given during radiation therapy?
Okay, so this is a very interesting question. I, for once, don't ask my patients to go on any special diets, because during radiation and during cancer treatment in general, the patients are already, they have very low appetite, and they are not, the best of themselves. They are not working to their full capacity. So I tell them that, you can have whatever you want. Just don't eat very spicy food, or don't eat, ground spices.
How much radiation therapy costs in
Yeah.
India?
Okay, so radiation therapy, the price of radiation therapy can change with, according to where you're living, and where you are seeking treatment. A very good thing about the recent times is that the government of India has launched something called the Ayushman Bharat, and then states have their own state insurance schemes, because of which a lot of people can get that treatment done for free. So basically, for some patients in some centers, radiation treatment can be completely free. But if you are talking about, say, a corporate center or a corporate hospital in, say, a tier 2 or a tier 1 city, so radiation therapy can cost anywhere between 1.5 to 2 lakh rupees for the entire treatment course. This does not include the price of medicines that the patient might require during radiation.
So my next question is, what are the best hospitals for radiation therapy in India?
So there are a couple of hospitals. I am currently working out of HCG Hospital in Baroda. HCG is actually a chain of hospitals across India. There's a huge footprint in Gujarat and in the southern states of India. Apart from that, there are other hospitals also, like there is Tata Medical Hospital, Tata Medical Center in Calcutta, and then there is TMH in Bombay, which is considered to be the mecca of oncology. And closer to where I work, there's the GCRI. Shout out to all these hospitals, because they are doing incredible job at treating the cancer burden in India, and incredible good quality research is also coming out of these places. So I'm very proud of all my colleagues who are working in these places, and giving us the best treatment possible.